Imagine how many women would have to choose between paying for the care that they need or paying their rent if Kavanaugh gets onto court and slashes these protections. We cannot let that become a reality. We cannot go back to the bad old days when women were charged more for care just because they were women. When being a mom counted as a pre-existing condition, and when women of color were much likelier to get priced out of insurance plans because they suffered from diseases like diabetes and asthma at higher rates than the general population. My heart breaks when I think about how Kavanaugh's confirmation would hurt expectant and new moms too, who would have a harder time getting access to the maternity care that they need. We are the only developed nation in the world whose rates of women dying from pregnancy-related causes is still rising, with Black women in particular more than 3 times more likely to die during childbirth. They deserve better than a judge who's already using his power to make it harder for women to access care. So yes, I'm a mother, I'm an American with disabilities, and I'm a woman of color. But I'm also a fighter, and I promise you that I'm going to pour my heart into stopping the confirmation of a man who'd rather cater to President Trump's whims than look out for the health of millions of women and women of color. Thank you all again for being here today. Now, I'd like to introduce Fatima Gross-Graves, the president and CEO of the National Women's Law Center, and a woman who's truly used her platform for good.
Thank you, Senator. Good morning. I am Fatima Gross-Graves. I am president and CEO of the National Women's Law Center. It's been about a decade since the Law Center revealed in a groundbreaking report that women were routinely discriminated against in the individual insurance market. Women were charged more than men for the same health coverage. Insurance plans didn't cover services that were specific for women, like maternity care. And insurance companies told women who had had cesareans or who had been treated for rape or even domestic violence that they had pre-existing conditions. An outrageous excuse for insurance companies to deny coverage and charge women more. That's why we needed the really critical protections in the Affordable Care Act, because being a woman is not a pre-existing condition. But Judge Kavanaugh is a threat to these very protections. He's been critical of the Affordable Care Act, and he could vote to allow insurance companies to once again deny coverage to people with pre-existing conditions. This isn't a hypothetical matter. There is a case that's working its way up to the Supreme Court, helped along by the Trump-Pence administration. And women, especially women of color, will suffer the most. More than 67 million women have pre-existing conditions. And for example, women are more likely to have chronic conditions. And Black women are more likely than white women to have these sorts of chronic conditions like diabetes or like hypertension. Latino women have higher rates of cervical cancer, also considered a pre-existing condition. And AAPI women are more likely to die from viral hepatitis. Brett Kavanaugh's nomination puts these women at risk. And it's not just the chronic conditions. We have a crisis in our country right now where women can literally die from giving birth. The U.S. has the highest maternal mortality rate in the world, and Black women who are dying at, as the senator said, 3 times the rate of white women. So it shouldn't be a surprise that just last week in a poll that was completed that Black, Latinx, and AAPI women said that affordable health care was among the highest issues of importance to them that the Supreme Court decides. We know that the Affordable Care Act helps to prevent that by expanding health insurance coverage. Over 90% of women in this country now have health insurance, and that includes over 33 million women of color. And the Affordable Care Act makes insurance companies cover maternity care. And it takes a multi-pronged approach to address health disparities. It also emphasizes quality health care. The nomination of Brett Kavanaugh puts all of this at risk. If cases challenging the health care law work their way up to the Supreme Court, and Kavanaugh is there to decide, we could see the Supreme Court undermine or even completely get rid of the Affordable Care Act. If that happens, there is no question women's health will suffer. The health and lives of women and families cannot be put in the hands of Brett Kavanaugh. The Senate must not confirm him. Thank you. And now it's my real pleasure to turn it over to Senator Mazie Hirono.
Thank you so much. It's great to join my colleagues and all of you, and particularly I see Rhea here and Anne-Marie. So for all of us, healthcare is important to every single person in this country, regardless of political or ideological stripe. And the group that is most going to be affected, in my view, as a member of the Judiciary Committee in the Senate, is the confirmation of Brett Kavanaugh and what might be in store for women in this country. So I am here to call upon all of the women in our country, particularly to awaken to this danger that is confronting us. And frankly, Judge Kavanaugh is supported by two very conservative groups, the Federalist Society and the Heritage Foundation. And the goals, among the other conservative goals of these two organizations, two of these goals, to repeal the Affordable Care Act, or to undo the protections of the Affordable Care Act, and to undo Roe v. Wade. Both of them will have huge implications to what happens to health care, and particularly, as you heard, to women's health care in our country. So you know that there is, as mentioned, there is a Texas lawsuit going on with 19 other states joining Texas, and with the support of the Trump administration, to challenge the Affordable Care Act's protections for those with pre-existing conditions. And you also heard that minorities and women have what are deemed pre-existing conditions, including, of all things, pregnancy. So this case, I have no doubt, is going to go all the way to the United States Supreme Court. There are states that are challenging Texas's challenge of the Affordable Care Act protections, including California, and I'm proud to say the state of Hawaii. This case is going to go to the Supreme Court, where if Judge Kavanaugh is confirmed, he will probably be the fifth vote. We will see with his confirmation many 5-4 decisions, and these decisions will not be good for health care or for environment and other situations. So, you know, the other thing that should be mentioned is that women of color rely much more on Medicaid, and a lot of the people on Medicaid are children, and they're going to be adversely impacted. So you can bet that I will have a lot of questions for Judge Kavanaugh when he comes before our Judiciary Committee. We will have a multi-day hearing process. At the same time, there is a tendency for all of President Trump's nominees to disclose very little of what their judicial philosophy is, or how they will be looking at cases that will likely come before them. We're not asking them, how would you decide such a case? We'd kind of like to know where, you know, how they would go about addressing the Affordable Care Act's protections. Are they going to interpret it narrowly? Are they going to go along with whatever the Texas court decides, which will likely, I hate to say, will likely side with Texas and the other 19 states, not to mention our own administration. So, as far as I'm concerned, as a member of the committee, I've also let it be known that Judge Kavanaugh, having reviewed some of his major decisions, many of them are dissents, which means that he's going against the majority of his own colleagues, that his dissents indicate that serious concerns that I would have about his ability to be fair and impartial. So he bears the burden of proof for me that he can be that kind of justice should he be confirmed. And now, I turn to Kirsten Gillibrand.
Thank you. I think this is a wake-up call for all of us, because what Judge Kavanaugh intends to do is to overturn Roe v. Wade. That's why he was on his list of 25. President Trump said that his intention of appointing someone from that list was to overturn Roe v. Wade. And make no mistake, if we overturn Roe v. Wade in this country, what could happen is that we will criminalize abortion, basically criminalize women who seek reproductive health care. And this is not far off because there are so many states that are already trying to do this. There's 13 cases that are already moving forward that could undermine abortion rights. In this country, 7 states today only have 1 clinic. 24 state legislatures are extremely hostile to choice. And we have 4 states that already have trigger laws. So the moment Roe v. Wade is unwound, they will make abortions illegal and they will criminalize it. In the last few years, in the last 7 years, states have passed more than 400 restrictions. Restrictions like mandatory waiting periods, 24 hours, 48, 72 hours, informed consent, 20-week bans, transvaginal ultrasounds. These are real restrictions to women getting access to basic reproductive care. So make no mistake, the intention is to take away women's rights to make decisions about their reproductive life. It is so undermining of women that you cannot control when you will have children, how many children you will have, and what care you need. And then you look at the issue of the impact it has on women of color. In 1973, when Roe v. Wade was passed, 90% of the deaths caused by illegal abortions were women of color. 90% were women of color who died because of not having access to legal, safe abortion care. This is going to have an overwhelmingly negative impact to women of color. This judge, Judge Kavanaugh, said he believes that it ensures free speech rights are more important than your free speech rights. He said he believes that insurers should be able to charge whatever they want for a pre-existing condition. And as Senator Hirono said, women of color have more pre-existing conditions than white women in this country today. So again, this judge will undermine the ability of women of color, particularly to survive, to get the care they need, and to be able to make decisions about when and how many children they have. The maternal mortality rates in this country are very high. So if you are forcing women to carry pregnancies to term against their will, you are saying that some of you will die. It is an issue of life and death for many women in this country. This is a moment when every woman in this country should know that her basic human rights are being attacked, they are being undermined, and they will be taken away if Judge Kavanaugh becomes the next justice. This is a very serious issue. This is a wake-up call. Do not take this moment lightly. You must be heard. You must speak out in all 50 states. This is not about any one senator or any one party. It is about 50 states of every person in this country, every woman and every man who loves women, to speak out about making sure that they have access to basic reproductive care, basic human rights to decide what will happen to their bodies, and being able to access the care they need, and to be able to have access to life, liberty, and pursuit of happiness. That is something that our founders wanted in this country, and you are basically taking it away from women if you move forward with this Kavanaugh nomination.
I think Rhea is next.
Yep. Our next speaker is Rhea Bedeau from Planned Parenthood, New York City patient.
Hi, my name is Rhea Bedeau, and I live in Brooklyn, New York. I'm here today because the health of millions of women in this country is on the line. Especially for black women like me, this can be life and death. Putting Brett Kavanaugh on the Supreme Court puts in jeopardy the policy and programs that saves lives every single day. About 12 years ago, I had a great job with wonderful health insurance. At the time, I went to a private OBGYN. During my annual Well Women exam, my Pap test came back abnormal. My doctor told me that I had precancerous cells, the most severe kind, SIN3. Really, I didn't need to hear anything after my doctor said the words may develop into cancer. I was scared. But thanks to my doctor and my excellent insurance, I got the treatment I needed. They told me I had to come back in 6 months to make sure the cells didn't return. But in 6 months, everything changed. I didn't have that job or the insurance that came with it. So when my OBGYN called me to confirm my follow-up appointment, I had to ask them how much the appointment would be out of pocket, and they said $600. That was more than I could afford. I told them to cancel the appointment, and honestly, I thought about skipping the follow-up exam altogether. But the doctor said she didn't care where I went for the exam, as long as I got one, and soon. Without it, I was putting myself at serious risk. So like many people, I ended up at Planned Parenthood. I got the follow-up care that I needed, and I was able to afford it. My Pap test came back clear, and it was a huge relief to me. Going without a test wasn't an option. Paying $600 wasn't an option. My only option was to go to Planned Parenthood, and I'm so grateful they were there for me. For millions of people, having health insurance is a matter of life or death. It's the difference between finding precancerous cells at your yearly exam or putting off care until it's too late. It's the difference between having the ability to access preventative care or losing future fertility. I felt that fear and uncertainty, and believe me, no one in the US in 2018 should have to go through that. Healthcare is a human right. Preventative care is crucial, and for many, the Affordable Care Act fills that gap. Due to systemic barriers, women of color are less likely to receive preventative services like Pap smears. And the fact is, Black women have the highest rates of breast cancer, and Latina women have the highest rates of cervical cancer. And cancer is the leading cause of death for AAPI women. If Brett Kavanaugh were confirmed to the Supreme Court, he would decimate women's access to affordable preventative health care, the kind that confirmed that I was clear of precancerous cells, or that could catch another woman's cancer early enough to save her life. That's why, a little over a year ago, I got on a bus and came down to Washington to fight for the Affordable Care Act and access to Planned Parenthood. I'd been watching the news and feeling hopeless that millions would lose their insurance. The only thing I could do was show up and make sure my voice was heard. Millions of people across the country felt that same way. They stood up and spoke up, and together, we saved healthcare for millions of people. Now, I'm back, fighting again, because my health and the health of millions is at stake. I believe that we can stop Brett Kavanaugh's confirmation. We must. Thank you.
Thank you.
Let me just introduce Anne Marie Benitez, National Latina Institute for Reproductive Health.
Thank you so very much, and thank you everybody for having me. I'm Anne Marie Benitez from the National Latina Institute for Reproductive Health, and we are the only national Latina organization that reproductive justice organization that represents the 28 million Latinas here in the United States. As you all have heard, Judge Kavanaugh has a dangerous judicial record, and if confirmed, will have devastating impact on immigrants, communities of color, women's health, and the LGBTQ community. This is someone who was selected from a pre-vetted list of candidates who have expressed their intentions to overturn Roe. For our communities, that's just one big negative impact that Judge Kavanaugh is going to have. The struggle for justice goes far from protecting just Roe. For Latinas, Latina immigrants, and women of color who already face significant barriers to their legal right to abortion and access to contraception, Kavanaugh's nomination is a pressing threat to our health and safety. We have seen Judge Kavanaugh's record, and it has demonstrated that if he is confirmed to the Supreme Court, he would be a vote to overturn and cut critical health care conditions. In 2015, Judge Kavanaugh supported allowing employers to deny their employees access to birth control coverage with no copay based on their religious or moral beliefs, allowing an employer's personal beliefs to infringe on a person's private medical conditions. And this is something that our communities cannot afford. We already face so many barriers. We already have a lot of inequities in regards to health, like, for instance, high rates of cervical cancer, which is something that is so preventable. And we also have one of the highest mortality rates when it comes to cervical cancer. And that's why today is so important, because we're not talking about just the health and dignity justice of folks. We're also talking about their lives that's at stake. In addition, the Supreme Court will soon be presented with cases focused on issues that disproportionately affect Latinos, like the rights of immigrants and asylum seekers, voting rights, workers' rights, and access to health care. For example, as Justice Kavanaugh has demonstrated a record on immigrant cases that have undoubtedly showcased his malicious belief that undocumented immigrants do not have constitutional rights. In September 2017, Judge Kavanaugh wrote an extremist legal argument opposing the court's decision in the case of Garza and Hargan, a case where the federal government sought to prohibit Jane Doe, an undocumented young woman who was in the Office of Refugee Resettlement custody, from seeking an abortion. Even after the court granted the young woman access to an abortion, Judge Kavanaugh openly pushed back against that decision, demonstrating his opposition to abortion. Recent Supreme Court cases are a testament to what is at stake. We need to know the next Supreme Court justice will uphold all constitutional rights of communities of color. More importantly, and more so than ever, we must lift up the threat that Kavanaugh's appointment would represent on our communities. National Latina Institute for Reproductive Health will continue to fight for the health, dignity, and justice for everyone in our community. And we are proud to stand with these senators today and with organizations and allies today to make sure we are very loud, that we keep up the fight, and that each senator hears why we cannot allow Judge Kavanaugh to be the next Supreme Court justice. Thank you.
Some of us can move that way. We're getting a little.
Oh, I'm sorry.
We're getting a little heavy on one side. Thank you. Well, again, thank you to all the speakers. I think you've heard very compelling cases from a diverse range of experiences and community groups represented up here. I would be very happy to take any questions that you might have. Yes.
On the Affordable Care Act, you all seem very confident that Kavanaugh would act to undermine it, effectively repeal it through the courts. What makes you so confident? Because his ruling on Obamacare previously upheld the law.
Well, his 2015 dissent, he was in the dissent for most of these. In his 2015 dissent under Sissel versus United States, he argued that the D.C. Circuit Court should consider a claim that the ACA's individual mandate violated the Commerce Clause and Origination Clause and was unconstitutional. So there are all of these decisions that he, writings that he's done when he was in the dissent that shows that he opposes the Affordable Care Act. And remember, he is on the list of judges that were selected by the Heritage Foundation as being opposed to the Affordable Care Act. And they didn't even choose anybody else. They chose, that's who they sent to the White House, and that's the short list that they chose from. And there are many more components of the Affordable Care Act that he has shown in his writings to be opposed to. Yeah.
Senator, for you and your fellow colleagues, are there any plans or possibly changes in plans to meet with the nominee?
I am not going to be meeting with him, but I am not on the Judiciary Committee.
I'm meeting with him on Thursday.
Yeah, and I'm not, because I'm also not on the Judiciary Committee, but I also have so much evidence of his views that I mean, there's no point, because I'm not going to support him.
Right. And you know, one of the things is, there's so much more out there that we're not even being allowed to look at, that the administration is hiding from the senators here, so that we cannot do our jobs fully the way that the American people voted and entrusted with us to do, which is to review these cases thoroughly. And so by hiding his work and all of the documents around the decisions he's made, the writings he's done, they're basically obscuring this true person from the American people. And I wonder why he himself has not, if he truly has nothing to hide, why would he not have come forward and said, you know what, release all of my documents. Release all of my documents. Let everybody see. If he's got nothing to hide, why would he be complicit with this administration in hiding all of this paper that is out there? Literally 1 million pages of documentation that shows why he's not suited to be on the Supreme Court.
Let me say something about the document battle. That is continuing. On the other hand, the hearing has been set for early September, and we need to proceed. There are enough indications as to where he would be on a number of these critical issues, including, by the way, the range of executive powers, which he considers to be pretty broad, and that's very dangerous considering the president that we have. So while the document battle goes on, I think that there will be a Freedom of Information Act lawsuit that's filed for the production of documents. But we also know that these documents may not be available to us until October. This is why votes matter. So the advocacy groups stand here and say we have to fight against his nomination. Well, the people who make that decision, first of all, will be the Judiciary Committee to begin with. And so, you know what, the members of the Senate have an advice and consent role in all of these nominees, and we take our responsibilities very seriously. So we are going to ask those appropriate questions. On the other hand, it is all of the senators who are going to vote on this nomination. Guess what? The Democrats, who likely, many of us will be opposing him probably. You know, I still need to meet with them. But we don't hold the majority. And guess how that happened? Votes. So all of the groups have got to encourage everyone to come out, especially the women who should be totally concerned and mobilized and to get out and go vote for those people who are going to support the Affordable Care Act, who are going to vote to make sure that Roe v. Wade is not overturned. And we don't have those numbers at the moment.
Right.
Any other questions?
Any other questions? All right. Thank you, everyone, for being here. Appreciate your participation. Thank you. Thank you so much.
Thank you so much.
You know, we'll keep pushing. We'll keep pushing.
Thank you so much. Hi.
Yes, yes.
Nice to meet you. Yes, I'm honored to be here.
I feel let's get right in front of the, can we get a picture with Mazie and,
Oh, yeah, let's do it. Let's do the
come over
group
here
photo.
so you're in?
Yeah.